Open heart surgery is something none of us want to experience, but there is a new alternative for some patients: implanting a stent in the heart through the wrist. We spoke with Dr. Michael Bagheri at Desert Regional Medical Center, who specializes in this type of surgery, and asked him about its benefits.
My specialty is interventional cardiology, meaning that any blocked arteries that has an indication to be fixed and could be fixed either surgically or through the skin, as we call it percutaneously. I do it through the skin without any cutting or dicing or slashing anything open. We just go through a tiny hole in the skin surface and make our way through one of the major arteries and go to find that blocked particular artery and open it up with miniature-sized tools, including balloons and stents that we deploy through the same tiny hole in the skin, and goes in, and we place it in the blocked segment of the artery and deploy it, and that's going to keep the blockage from coming back. The procedures that I do historically used to be done through a major artery in the groin called femoral artery. Personally, I did about 1,000 cases that way before I switched to my particular favorite way of doing it, which is transradial. We use this tiny artery in the wrist called radial artery. Everyone has it. And it's probably 2 millimeter or 1/8 of an inch in caliber. And we access that. It's a very delicate procedure. The artery is very delicate. It's much smaller than the femoral artery. So we access that and do our procedures through that procedure, basically through the hand. And by doing that, we have dramatically cut back on the risk of bleeding and complications of the procedure.
What other areas of the body can be treated with this new procedure?
We can work on the carotid arteries. We can work on the subclavian artery, which is the main artery in the hand that vascular surgeons used to do bypass surgery to treat it. And now we can fix it through the same tiny skin with a stent and a balloon. And or we can go down to the heart, which is primarily what we do, and fix the blocked arteries through the same tiny hole. I have personally gone down to the kidneys and fixed blocked arteries in the kidneys, and down to the legs. Basically, when I'm done with the procedure, the patient can walk off the table, okay, and go to his room. There's no downtime, there's no recovery time. All they're going to have is a wristband, like my watch basically, that is going to prevent the bleeding. And patient can go home same day in just a couple of hours with no problem.
We wanted to know if this new procedure often replaces open heart surgery.
Open heart surgery still has its place, but we have been able to avoid open heart surgeries by fixing the blockages through the skin with a very good outcome and long-lasting results. Still on occasions when there is anatomic variance of the arteries or blockages that we feel, or personally I feel, that I cannot get a satisfying results with it, those will be referred to surgeon as before. But many other cases we could avoid surgery by just doing this procedure.
Dr. Bagheri tells us how successful and rewarding transradial procedure has become.
And we have had very good feedback from the patients. Patients are happy. The outcomes are outstanding, and everyone who has come across the procedure, including primary care physicians who send me the patients, have been very pleased. And so it's been very rewarding so far.